So today we'll begin a simple primary care review on ulcerative colitis. Ulcerative colitis, also known as UC, is a recurring episode of inflammation limited to the mucosal layer of the colon. It commonly involves the rectum. The clinical manifestations: colitis, diarrhea with blood, colicky abdominal pain, urgency, tenesmus, and incontinence. It may be a self limited episode of rectal bleeding that occurs weeks or months earlier. Disease severity. It is important in guiding clinical management and to predict long term outcomes. Mild UC. Most patients with ulcerative colitis present with an attack of mild severity at presentation, less than or equal to 4 stools per day with or without blood, no signs of systemic toxicity, and a normal erythrocyte sedimentation rate. Moderate UC, greater than 4 bloody stools per day, mild anemia, abdominal pain that is not severe, and a low grade fever. Severe UC includes greater than or equal to 6 bloody stools per day, severe abdominal cramping pain, a fever of greater than 37.5 degrees Celsius, tachycardia, of which a heart rate of greater than or equal to 90 beats per minute, anemia, hemoglobin is less than 10.5 grams per deciliter, an elevated ESR of 30 mm per hour, and rapid weight loss. Extraintestinal manifestations: Musco, mu- musculoskeletal. Arthritis primarily involves large joints and ankylosing spondylitis. Eye, uveitis and episcleritis. Skin, erythema nodosum and pyoderma gangrenosum. Hepatobiliary, primary sclerosing cholangitis and fatty liver. Hematopoietic coagulation, increased risk for both venous and arterial thromboembolism. Laboratory studies, stool studies, routine stool cultures, stool PCR for C. difficile toxin, stool microscopy for ova and parasites, Giardia stool antigen test. STD tests include C. trachomatis, N. gonorrhoeae, HSV, and Treponema pallidum. Blood studies include a complete blood count, electrolytes, albumin, erythrocyte sedimentation rate, or C-reactive protein. Endoscopy and biopsy. Endoscopic findings in patients with ulcerative colitis are nonspecific. Biopsies of the colon would be the diagnostic study. Diagnosis. The diagnosis of ulcerative colitis is based on the presence of chronic diarrhea for more than 4 weeks and evidence of active inflammation on the endoscopy and chronic changes of the biopsy. Initial management. Topical mesalamine. Mesalamine topical is the first line of treatment for patients with mild to moderate ulcerative proctitis or proctosigmoiditis. Topical glucocorticoids. Topical glucocorticoids are for patients who cannot tolerate topical mesalamine. Oral 5-ASA agents. Oral 5-ASA medication is for patients who are unwilling or unable to tolerate topical medications. Thank you.